go ahead and put gloves on. And we'll start with vital signs. Any flu-like symptoms in the last 48 hours?
No.
Okay, I'm going to put this sublingual under the tongue. Can you please hold it for me? Thank you. This will measure your oxygenation. It's going to go on your index finger. Okay, go ahead and open. 96.2 Fahrenheit. Did you have anything to drink before coming in?
Just water.
Okay. And we'll take your blood pressure as well. Any family history of hypertension?
My mom's side.
Okay. Are you taking any medication for blood pressure?
No.
Blood pressure is actually kind of low, 95/70.
Okay.
Do you feel lightheaded or dizzy at all?
No, not right now.
Okay, that might be your normal actually, so we're gonna keep an eye on it.
Okay.
Okay, so heart rate is 90. Oxygenation 99% in room air. Blood pressure was 95/70. Respiratory rate is about 18. And temperature 96.8 Fahrenheit. Okay, I'm gonna have you lay down and I'll start with the scalp area.
Okay.
I'm going to start by palpating your neck. We're looking for any lymph node enlargement. Palpating submental lymph nodes right under your chin. Going back to the preauricular lymph nodes. And postauricular lymph nodes. Moving down the neckline. There are no signs of lymphadenopathy. Just gently palpating the auricular side of the ears. Let me know if you feel any kind of pain. Any surgeries?
Just my wisdom teeth.
Any complications from that?
No.
I'm going to pull down on the earlobe. Let me know if you feel the pain. And back. And upwards. Okay. Checking masseter bone behind the ear. No tenderness there. I'm going to palpate your sinuses right above your eyebrows. Not feeling anything swollen. And under your eyes. Palpating the side of the cheeks. Okay, slowly go ahead and open your mouth a little bit more and close it. Okay. I'm going to check a few of the reflexes here on the face. I'm going to ask you to relax your jaw a little bit more. Perfect. Good. I'm going to take a few measurements, looking for any asymmetry. Okay, I'm going to check the head circumference. If you can please go ahead and lift your head up for me. Relax. Perfect. Can you go ahead and tell me if you feel this? Tell me when it stops.
It stopped.
Do you feel this? Okay, tell me when it stops.
Stopped.
What about now? Tell me when it stops.
It stopped.
Okay, tell me when it stops.
It stopped.
Tell me when it stops.
It stopped. It stopped. It stopped.
Okay. I'm going to check your tympanic membrane. If you can go ahead and turn your face to the right. Very good. A little bit of earwax. That's normal. I'm not noticing any redness. Tympanic membrane is pearl gray. Everything looks good. And go ahead and turn your head to the left. Okay. Same thing, a little bit of earwax, but tympanic membrane looks normal color as well. Very good. I'm going to touch it with two textures. One is going to be dull. This is what dull is going to feel like. And the other one is going to be sharp. This is what sharp is going to feel like. So go ahead and tell me if you feel sharp or dull.
Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. 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 Sharp.
Okay. Going to check trachea. Make sure that it's midline. Also your thyroid gland. It does seem to be a little bit enlarged. Maybe we're gonna send you for an ultrasound. Can you go ahead and swallow for me? Okay. I'm going to check your scalp now. So I'm looking at the scalp area. See if there's any redness. I'm not noticing any dandruff. Do you have any allergies?
No. Just seasonal allergies.
Okay. Go ahead and tell me if you feel this sharp all the way. Okay. And what about now? Does this feel sharp all the way? Okay. Does this feel cold or warm?
Cold.
What about now?
Cold.
And now?
Warm.
I'm not seeing any signs of parasite infestation. Scalp looks healthy. No vitamin deficiency. Can you please tell me if this feels cold or warm?
Cold.
And now?
Warm.
What about now?
Cold.
Go ahead and tell me if you feel this sharp all the way.
I don't know.
Okay. I'm going to ask you to flip on the right side for me so I can take a look at your back.
Okay.
Can you please tell me if this feels sharp all the way?
Mm-hmm.
Okay. And does this feel cold or warm?
Not warm.
What about now?
Cold.
And now?
Cold.
I'm seeing a little bit of redness at the base of the skull, and that sometimes is an indication of an allergy. We can go ahead and definitely do some tests to see if you're allergic to any kind of foods. Go ahead and tell me if it feels cold or warm.
Cold.
And now?
Cold.
And does this feel sharp all the way?
Yes.
Okay. Does this feel cold or warm?
Cold.
And now?
Cold.
And now?
Warm.
Go ahead and tell me if you feel sharp or dull.
Dull. Sharp. Sharp.
And does this feel sharp all the way?
Yes.
Okay. Let's go ahead and check your abdomen now. I'm going to go ahead and lift the gown up a little bit. Okay, we're starting with a general visual inspection. We're looking for any asymmetry, discolorations, or skin lesions. Okay. I'm going to listen to your belly first. This is going to feel a little bit cold. Okay, no more sound. I'm going to percuss. Let me know if you feel any kind of tenderness. And I'm going to gently palpate, starting with the right side, checking for liver enlargement. Let me know if you feel any kind of pain. Okay. I'm not feeling any masses. Just checking capillary refill within 3 seconds. Normal colors. Not seeing any palmar erythema. To check for clubbing all the nails, I'm going to ask you to put your fingers like this.
Okay.
Just these
the
two. Okay, perfect. So we are seeing that diamond shape. That looks normal. Just going to let the ground one more time. Okay. Extend your index finger for me. You're going to take the circumference of the arm. And the other side. Okay, that looks good. Relax your arm. Alright, and we're going to go ahead and check your legs for any pedal edema. Okay, taking pedal pulses. 2 plus bilateral. Good. Capillary refill within 3 seconds. It's very normal. Checking in between the toes. Okay, I'm noticing a little bit of dandruff there, so we're gonna go ahead and clean in between the toes. I'm gonna go ahead and toss this. Okay, go ahead and tell me if you feel this on the left or right.
The right. Left. Left. Right. Left. Right.
Okay. Now we're going to check your Babinski reflex. Go ahead and relax your foot. Good. Good. And I'm going to ask you to pull your upper part of your feet towards you and try to resist. Good. And now push with your pads. Very good. I'm going to ask you to try to spread out your toes. So let's start with the left foot first. Try to spread out your toes. I'm going to try to close them. Don't let me do that. Good. As we go inward, it should be weaker and weaker. Okay, perfect. And we'll do the same thing on this side. Okay. Good. And now try to wrap your toes around my fingers. Both feet in the same time. That's perfect. Okay. I'm going to put my hands under your heels. Go ahead and push with your heels. Okay, a little bit stronger on the right side. All right. Go ahead and bend this knee for me, please. Okay. And we'll do the same thing on the other side. Okay, very good. All right, I'm going to have you dangle your feet now. Okay. Good. And let's try that one more time over here. Okay.
Sorry.
That was good. No worries. Go ahead and try to resist me pushing your legs in. Okay? And now I'm going to try to pull them towards me. Good. Go ahead and try to lift your knee up. Good. Same thing on the other side. Okay. I'm going to try to open the legs. Don't let me do that. Good. I'm going to try to close them. Don't let me do that. Okay. Very good. All right. I'm going to go ahead and continue checking your reflexes. So just relax for me now. Good. Relax your arm. Perfect. Good. 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 Okay. Perfect. Very normal reflexes there. Go ahead and put your arms like this in front of you. I'm going to try to push them down. Don't let me do that. Very good. I'm gonna try to open them. Don't let me do that. Okay? And I'm gonna try to close them. Perfect. Go ahead and squeeze my fingers, please. Very good. And now spread out your fingers. All right, go ahead and relax your arms. And now I'm gonna have you turn around and I'll open the gown. Okay. Take a look at your spine.
Okay.
Starting with a visual inspection, I'm noticing some redness on the upper side of the neck. It looks like you had some recent treatment. Is that correct?
That's correct.
Okay. I'm going to start by palpating your spine, checking for any signs of spine deviations. Sometimes we see that very often. No signs of spinal deformation. I'm seeing a little bit of lordosis, but we can definitely keep an eye on it. I am noticing a little bit of redness here on the back. Do you know what could have caused it?
I slipped on some ice and fell.
Okay. And it does look like it's been longer than a month.
Mm-hmm.
I'm noticing still a little bit of bruising, but it doesn't seem to be tender. And I'm not feeling any kind of swelling. I'll take some measurements to check for asymmetry. Go ahead and take a deep breath in for me. And exhale. And again, breathe in. Breathe out. Breathe in. And one last time. Okay, signs of pneumonia. Can you please tell me if you feel this on the left or right?
The right. Left. Right. Right. In the middle. Middle. The middle. Left. Right.
Did you feel that equally on both sides?
Yes.
What about now?
Yes.
And now?
Yes.
Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull.
Okay. So I'm going to touch you with two textures. One is going to be sharp.
Mm-hmm.
It is a little bit pokey in essence, but it's not going to protrude the skin.
Okay.
And then the other one is a fluffy texture,
Okay.
and most of the people do recognize it as being dull.
Okay. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Very good. I'm going to tap along the spine, looking for any abnormal neurological responses. Let me know if you feel any kind of pain. Okay. All right, I'm gonna have you get dressed and we're going to go ahead and discuss the results.
Okay.
Okay, Tori, everything looks very good. We're gonna have you come back in about 6 months to do another exam, but I'm going to schedule you for that ultrasound. And then I'll call you back with the results. Everything looks healthy. Do you have any questions for me about the next steps?
No.
Okay. Okay, perfect.
Thank you so much.
Thank you for coming in. I'll see you soon.
See you soon.